It's funny how you start remembering these patients after, you make a discovery in the cadaver lab. You go, oh man, you see that patient in your mind that you couldn't quite figure out 4 years ago or 5 years ago. What's your thought on that additional site in addition to the soleal sling?
I think what you're referring to is the deep posterior distal compartment. So
Right.
we think of the compartments in the lower leg as the deep, you have the anterior and the lateral, you have the
Right.
superficial posterior, and you have the deep posterior.
Correct.
One of the things that, again, just a family friend, Dr. Detmer, and Epiphany, was that essentially he discovered there is a deep posterior distal compartment and the deep posterior proximal compartment, and they can be completely separate. So you can release the compartment at the soleal sling, and it does not release the compartment at the lower ankle. And that is why when I do tarsal tunnel releases, I've had a number of failures early on where we would release it, at 5 centimeters above the medial malleolus or something of that nature, just as
Right.
far as you get a little retractor, look up there and divide the fascia.